Welcome back. In this section, we are going to learn all about bone formation or osteogenesis. Osteo meaning bone, genesis, the making of bone or bone formation. And so bone formation in humans starts at about 6 weeks of gestation. What you can see up here in the upper left-hand side, that's about a 12 millimeter embryo, and you can see just the beginnings of bones being formed. By the time you get down to where you see these cute little feet in the bottom, that is at about 21 weeks gestation. So a lot more bones have formed. And by the time you're about ready to be born, we can see that the skeleton is not complete. You may think the skeleton is complete because the baby looks like a normal baby, but you can see that there's actually a lot of gaps between the bones. Um, Bones are not all formed at birth. And in fact, bones continue to form all the way through adolescence and some all the way until about age 25. And then after that, throughout the rest of your life, you're going to have a lot of remodeling. Anytime there is stress, they can change shape, they can change their size, and they can change their strength. Like if you become an athlete or you start working out in the gym, the density of the bone will increase. And of course, if you have a fracture, bone repair will occur. Okay, so let's go ahead and get started. In order to understand bone formation, we have to learn who are the players, and we have three different cell types. Okay. The first one is the osteoblast. So you remember the term blast, those are the cells that are actively secreting, and remember the prefix osteo, which has to do with bone. So these are the cells that are making and secreting lots of collagen and lots of the organic matrix, the extracellular matrix. And we usually can find them sitting on the external surface of a pre-existing piece of bony spicule or the primitive connective tissue that's going to become bone. And I'll be showing you when we're looking at actually forming bone from scratch. They also will be secreting the chemicals, calcium, which will start the calcification process. And realize that once they start secreting calcium into that osteoid, into that bony matrix, then they get trapped. And when they get trapped, they're going to get trapped with a little space around them, that little lacuna, and then they are going to be renamed as osteocytes. They're not going to be able to build new bone. They're going to become bone maintainers. They're still going to be making and secreting collagen and small amounts of matrix. So those are the two main players, but there is a third one that's unrelated to the osteoblast and the osteocyte. It comes from a totally different precursor cell, and it is called the osteoclast. And it is this big cell right here. It's this huge cell, and notice it has a lot of nuclei. Here's another example in the lower right, an osteoclast showing half a dozen nuclei. And this one up here in the upper right is a great example because not only does it show the multiple nuclei, but it also shows the little ruffled edge that all the osteoclast has. And that's because osteoclasts have a lot of lysosomes, and at this ruffled edge, that is where they release the lysosomal contents. And so if you did your studying when we learned all about the cell, you understand that the lysosomes contain digestive enzymes. And so when the osteoclasts are releasing the lysosomal contents, those digestive enzymes are going to be breaking down not only the collagen, that's in the extracellular matrix, but also the calcified matrix and releasing the minerals, releasing the calcium so it can be absorbed into the bloodstream. All right. So those are the players that are going to be involved. And so there are two methods of making bone, and another word for making bone is ossification. And for both of them, they start with the same stem cell. So there is a stem cell whose name for this class you don't need to know, and is located in fetal connective tissue. And there's a fetal connective tissue called mesenchyme that gives rise to all the different types of connective tissue. And in this case, that stem cell is getting a message saying, hey, I want you to make bone. So become an osteoblast. And then, it can become an osteocyte. Okay. So the first type of ossification is called intramembranous ossification. So look at that name. Intra meaning inside, membranous, inside a membrane. So this is when bone is going to form within a connective tissue membrane. The second one is called endochondral ossification. Endo also means inside, but as you know by now, chondro means cartilage. So here, bone is going to form inside cartilage. In other words, we're going to have a piece of cartilage that looks just like the bone, and bone is going to replace it. And that's because cartilage cannot maintain our weight. It can't do the weight bearing. It can't do the stuff that bone can do. So having bones made out of cartilage doesn't do us any good. Okay. So let's talk about intramembranous ossification first because it has less steps and it's easier to understand. So for this one, there are very few places in the body where this happens. It only occurs in these flat bones in the skull. Most of the bones of the face, don't have to learn the names of the bones of the face, so just stick with the skull, the mandible, which is your lower jawbone, and your clavicle, your collarbone. These are the parts of your body where intramembranous ossification occurs. So up here, that's it. And this is the type of ossification that occurs early. It starts at week 6. So this one starts inside a membrane, and the membrane is that fetal connective tissue, mesenchyme. So learn the word mesenchyme. So we have mesenchyme connective tissue just hanging around, waiting for whatever kind of message it's going to get. And it gets the message, hey, I want your stem cells to become bone. So the stem cell that can become cartilage or bone says, fantastic, we're going to become bone. So that stem cell becomes an osteoblast. Okay, so little cell from the mesenchyme gets the little message, and shazam, it's now an osteoblast. And this part of the mesenchyme where the bone is going to form, where the osteoblast is now located, because the osteoblast is going to do its osteoblast job. This is called an ossification center. In other words, the location where ossification is going to occur. So what's the osteoblast going to do? Well, it's going to secrete its organic matrix. It's going to secrete fibers. Then it's going to mineralize it. It's going to get hard because there's calcium in it. Osteoblasts on the surface are fine. Osteoblasts that are trapped, they're going to become osteocytes. Okay. So we've got calcium in the bone, osteocytes in the lacuna, and then at the edge, we're going to have osteoblasts. This is our ossification center, and it's surrounded by mesenchyme. And in that mesenchyme, we still have stem cells, and we've got a bunch of fibroblasts. So we've got a bunch of fibers because it's connective tissue. So then what's going to happen is some of these other cells get the message and they go, yes, we need to make more fibers. You are going to become fibrous connective tissue. Okay. So the osteoblasts are going to continue forming spongy bone. Some of the cells from the mesenchyme are going to turn into blood vessels. The blood vessels are going to enter where the spongy bone is because some of them got a message saying, hey, you're becoming blood vessels. Other cells out here got the message, hey, you're becoming fibroblasts and you're creating a bunch of fibers on the edge, and you are going to become periosteum on both sides of this piece of bone. So now we have bony trabeculae surrounded on both sides of periosteum. We have osteocytes trapped in the bony spicule. We've got a lot of osteoblasts on the edges of the bony spicule. We're going to be doing some bony remodeling we haven't learned about. And so we're going to start changing some of that spongy bone to compact bone on the edges. Okay, so that we will eventually have an outer bone collar of compact bone. We're going to have a bunch of osteoblasts that are lining between the periosteum and the compact bone. This is where we're going to find our osteoblasts. Then we're going to have our compact bone. Then we're going to have our spongy bone, and we're going to have blood vessels all the way from our periosteum going into our central canals of our compact bone and making their way all the way into the spongy bone. So when we look at photos, that's what mesenchyme looks like. Doesn't look like a whole lot of anything. We've got cells and we've got mostly non-cell stuff. And it gets this message. I'm showing you where the ossification center is. Over here, we've got trabeculae already forming, and you can see lots of osteoblasts on the edges, and you can see trapped osteocytes in their lacuna in the bony spicules. You can see this is more developed, and over here we're starting to form some periosteum, and over here we can see that periosteum has formed on both sides. And I don't have any compact bone showing on either side. So take these pictures and talk yourselves through all the steps. And remember, because this is starting with mesenchyme, and we're only using osteoblasts and osteocytes, this is intramembranous ossification. And only after you've talked yourself through this and you totally understand this one, should you move on to the second one. Okay, now the second type was endochondral ossification. So here, remember we started with mesenchyme that had stem cells. And those stem cells, remember I said the same stem cell could become cartilage or bone. And they got the message to become cartilage. So they became chondroblasts, and then they became chondrocytes, and they made cartilage in the shape of the future bone. So for endochondral ossification, we're starting with a piece of cartilage. So that's why we're starting with something that's blue, a piece of cartilage. And so remember that piece of cartilage would be surrounded by perichondrium. But because we're going to do ossification, we are now talking about those stem cells, those stem cells that were here surrounding that piece of cartilage that got the message become chondroblast. Now we're getting a new message. So it's just like if you were a chef at a backyard barbecue and you were told you're making burgers and you're sitting there making burgers, and all of a sudden someone comes up and says, no, now I want you to make hot dogs. And then you switch, you go, okay, I'm making hot dogs now. So that's what's happening. You're no longer making cartilage. So now it's got the message, we're making bone. So you're not making chondroblasts. Now you're making osteoblasts. Okay. So all those chondroblasts that were sitting in that perichondrium, now they're osteoblasts, and we're going to call it periosteum because we're going to be making bone. Okay. And so those osteoblasts are going to do what osteoblasts do, which is secrete the matrix, and that matrix is going to become calcified. And they're going to do that right around the diaphysis of what would be the bone. And so now we have a piece of calcified bony matrix right around the middle of the cartilage. And you're going, okay, that's great. And this matrix, now if you look at it, you would see osteoblasts all around the edge of the bone. You would see osteocytes surrounded by their lacuna in the calcified matrix. And this area is known as a bone color. So basically, it's like taking a piece of cartilage and putting concrete around it, right? A bone color, concrete. And this color gets really thick. And so I want to ask you, how was that cartilage getting its nutrition? Did it have any blood vessels going to it? And you're going, no, Dr. Powell, I remember. You told us cartilage was avascular and had no nerve supply. Yeah. So the only way that cartilage was getting its nutrition was diffusion from blood vessels out here. Nutrients were diffusion. But now we've got a bone color. We've got a layer of concrete. We've got multiple layers of concrete surrounding it. Are nutrients going to be diffusing through that layer of concrete? Nope, it's not. So what's going to happen to the chondrocytes in the cartilage? Well, the bone is fine because the bone's got blood supply. But that blood supply is for the bone, and the bone's not sharing. Not sharing. So the hyaline cartilage has lost its diffusion blood supply and becomes what we call ischemic, meaning no blood supply. So those cells are dying. And when those cells die, we end up with a cavity here in the middle of the cartilage. Not a good thing. And so what's going to happen, you can see that cavity right here. You see there's a space? Yeah, nothing there. Here you can see it's pale. It's not nice and healthy like the cartilage on the ends. Here it's pale. So now what's going to happen is we are going to have what's called a primary ossification is going to take place. A blood vessel is going to go through that bony collar into that hole, into that space. And it's going to drag cells from the surrounding mesenchyme in with it. It's going to drag osteoblasts into that cavity with it, into this primary ossification center. And what are those osteoblasts going to do? Their job. They're going to lay down osteoid, that organic matrix. And then after that, they're going to calcify it, make it rigid. Then they're going to retire and become osteocytes, trapped in a little hot tub in their lacuna. Yes. And so we're going to end up with spongy bone, replacing the cartilage in the diaphysis of what used to be that cartilage model. Okay. And so you can see that here on this fetal picture. Do you see this bright pink stuff? That is spongy bone, and the blue is showing that there's still cartilage at the two epiphyses. And you can see that for this phalanx as well. Isn't that kind of cool? Okay. Then what's going to happen? The osteoclasts are going to come in because bone is remodeling 24/7 your entire life. We are never happy with just laying down bone, because if we lay down bone and we don't do anything to it, it becomes very brittle and it becomes weak and it will fracture. So we're constantly remodeling our bone and laying down new bone. And so the osteoclasts are going to come in and they are going to absorb the spongy bone. And when they absorb the spongy bone, they're going to make a medullary cavity. Now, does that term sound familiar? A because we already learned about the medullary cavity in the diaphysis of a long bone. And that's exactly what I'm showing here. Do you remember what filled up the medullary cavity? Hope you do. Okay. And then that's what happens until you're born. Okay, and we're going to have more remodeling. We're going to form compact bone here on the outside. But then right around birth, in the two epiphyses, we're going to have secondary ossification centers form in each epiphysis. Yes. So we're going to have bone with a medullary cavity in the diaphysis. Then we're going to have cartilage, and then we're going to have a secondary ossification center in the epiphysis. And then we're going to have cartilage at the end. So in the spongy bone in the diaphysis, as well as in the spongy bone in the epiphysis, this is where we find our red bone marrow. What happens in red bone marrow? That's where hematopoiesis occurs. Whereas in our yellow bone marrow is what we find in the medullary cavities of our long bones, in the diaphysis of our long bones. So looking at here, we have our articular cartilage, which is hyaline cartilage on the outer surface on each epiphysis of the long bone. And we still have hyaline cartilage between the primary and the secondary ossification centers. And this is what is the epiphyseal plate, what you know as the growth plate. Only now you have to call it the epiphyseal plate. Notice the epiphyseal plate is not in the epiphysis. It's between the epiphysis and the diaphysis. We're going to talk more about the epiphyseal plate in just a couple slides. So here's what a photomicrograph looks like of this end. Okay. We've got the articular cartilage on the end. We've got the epiphyseal plate right here. We've got spongy bone here with red bone marrow with lots of hematopoiesis going on. We've got spongy bone here. And you see how this part of the spongy bone looks a little bit different? And that's because stuff is going on here related to this epiphyseal plate, which we will see shortly. Okay. So this correlates to this spongy bone, and this correlates to this articular cartilage, and this correlates to that epiphyseal plate. Okay. Oh, and here, this bright pink here that you can see going right here, that is going to be your periosteum. You can see it going right here around the outside of the bone. Okay. So let's look at the epiphyseal plate a little closer. We have hyaline cartilage between the ossification center, and here is your epiphyseal plate or your growth plate. This is where the bone grows longer. So here is the thing. If that piece of cartilage, if the only thing that happened was that piece of cartilage became bone, then you wouldn't grow any longer. But remember, there's only two ways we can make bone, and one is from mesenchyme, which is a fetal connective tissue. Okay, so your growth spurt happens when you're 10, 12, 14 years old. You don't have any fetal connective tissue left over. So the only way you're going to make bone for a growth spurt is with endochondral ossification, which means by taking cartilage and making bone. So the only way you can grow taller is if you make new cartilage, grow taller from cartilage, and then that cartilage becomes bone. Does that make sense? Because here's what your bones look like on X-ray. The bones are white and the cartilage are the dark lines. If we just took this dark line of cartilage and made it into bone, you wouldn't be growing anymore. So in this epiphyseal plate where cartilage is, we've got to make it longer by making new cartilage. And then we have to replace that cartilage with bone. So when we look at this epiphyseal plate, right here where the little box is, this is what is happening. Okay, so this end is the epiphyseal end, and this end is the diaphyseal end. So this end has bone. Okay, right here we've got bone. Right, we've got spongy bone going on. Right here we've got spongy bone going on. So right here, this is cartilage that's hanging around. So in adolescence, when you're hitting your growth spurt, it's because this cartilage is getting chemical messengers that's saying, you know what, cartilage, it's time for you to undergo mitosis. So that's what these cells are doing. Do you see how the nuclei are huge? These cells are dividing. They're very mitotically active. Do you see how, like, these cells are just kind of hanging around kumbayaing, not doing much of anything, but these cells, the nucleus is huge. There's a lot more energy being used. These cells require a lot more nutrition. Now, remember, all the nutrition is coming from diffusion from this end. Okay. So these cells have a full buffet. These cells right here, they're getting lunch. These cells right here are getting leftovers. And then these cells here, there's nothing left for them. So these cells here are dying off. Okay. So we had a resting zone of cartilage, and here we were making new cartilage. And then by here, there's just isn't sufficient nutrition that now we have a cartilage dying zone. And then the bone cells, they are going to seize the day, carpe diem, and basically, because we've got those osteoblasts just sitting here, they're going to start producing bony matrix and start replacing this and making bony spicules growing up to replace the dying zone cartilage. So the bone is growing towards the epiphysis. The cartilage grows, pushes the epiphysis up. Okay, so at both ends, the epiphyses are being pushed away from the diaphysis, and then the bone is growing towards the epiphysis at both ends. So it's really kind of a cool phenomenon. And that's going to happen. And sooner or later, there's not going to be any more messages going to say, make new cartilage, but those osteoblasts are going to keep on replacing until there's nothing left. Okay. So what I'd like you to do now is review the cells. These 4 slides have to do with one type of bone formation. review it again, and then make sure these 5 pictures you go in great detail and talk about the timing of both the primary and secondary ossification. Oh, and one more comment. Do you remember how I said that intramemory started first at around 6 weeks, 5 weeks to 6 weeks gestation? Well, the endochondral, it starts 1 week later, okay? Which, in the grand scheme of things is not that much later. However, if you're a 5-week fetus versus a 6-week fetus, that's 20% of your lifespan later. So it is significant for that time span. For us, 1 week is not significant. All right. So thank you so much for the hard work. This is the section that takes the hard work. Come back and we are going to learn some more interesting thing about bones. We are going to talk next about how bones grow. Now that you've made them, you need to grow for your entire life because you're not the same size you were when your bones formed. So I'll see you shortly.